Welcome to the Radiology Review podcast, your on-the-go source for radiology education with your host, Dr. Matt Covington, a board-certified radiologist. Please follow the podcast on Twitter at RadRevPodcast. Send emails to theradiologyreview@gmail.com or visit the website theradiologyreview.com.
There are two general types of radiation detectors that I want to discuss right now. The first type to remember are the gas detectors, and the second type are the scintillation detectors. In terms of gas detectors, what I'm talking about are radiation detectors that are filled with gas, and within that gas you have ionization events as radiation passes through. By applying a voltage across the detector, you end up creating ions that drift and are measurable. Depending on the voltage that is applied, you can have an ion chamber, which is a lower voltage, or a Geiger-Muller counter, which is a higher voltage. In the lower voltage ion chamber type detector, you have a few advantages that you should keep in mind. The first advantage is that the amount of charge the detector ends up reading is directly proportional to the number of ionization events within the detector, meaning that your detection is proportional to the energy that is deposited within the detector. So ion chambers can directly measure the intensity level of radiation exposure, such as air kerma and rad. So what are ion chambers that we use? The first is a dose calibrator. Okay, remember, dose calibrator is an ion chamber. That is different from a well counter, which is a scintillation-based detector. We'll get into that later. But remember, dose calibrator, ion chamber. What other ion detectors do we have? One is simply the ionization chamber detector, for which a code name is the QD-Pi. A QD-Pi or ion chamber detector can measure a large flux of radiation. So if you wanted to measure the radiation coming directly out of a CT scanner, the air kerma, you would use an ion chamber. I've seen that on practice exams and things like that. If you increase the voltage beyond the ion chamber region, you end up getting a Geiger-Muller detector. And basically what happens here is the detector gets super sensitive. Even a very low radiation rate incident upon the detector will cause a large cascade event. And in this region, the amount of radiation that is detectable is very small. So these tend to be our survey meters, which we commonly know as the Geiger-Muller meter. Remember, the Geiger-Muller meter does not directly measure exposure, but you can calibrate it within a selected energy range to give you a reading of milliroentgens per hour. I would look at an image of the Geiger detector and see how you have the different calibration levels, and know if they give you an image of a reading on a Geiger-Muller that you may have to multiply the reading by a factor depending on the switch settings that are displayed. The Geiger-Muller meter is commonly used to detect contamination, and you use it to survey radiopharmaceutical packages that may be delivered. I will go through later a dedicated podcast on how to receive a package in nuclear medicine, because there are a lot of questions that tend to get asked about the simple act of receiving a package, which in the nuclear medicine world is really not that simple. So I promise we will cover that later. So to review, gas detectors, the ones I would keep in mind for the core exam: dose calibrator, ion chamber, Geiger-Muller detector. Let's move on to the scintillation detectors. And these use a sodium iodide crystal that you should be familiar with at this point. That's what's used in the gamma camera, and I assume you understand scintillation events, where the radiation hits the crystal and actually causes light production, and then you can convert that light and detect the radiation. Certain detectors create images from this, such as the gamma camera. Others don't detect images, but detect the radiation, and we use that information in other ways. The two main scintillation detectors I would know for this purpose today are the thyroid probe and the well counter. Okay, these are both non-imaging devices that still use scintillation sodium iodide crystals. The well counter is basically a sodium iodide crystal that has a hole in the center of it that you can put test tubes in, or you could put other samples such as a wipe test in there, and it's very sensitive. Do not confuse the well counter with the dose calibrator. Okay, that's very common, but they are different. Dose calibrator is a gas-filled ion chamber, and it can measure activities up to roughly 40 gigabecquerel. The well counter is used to test for much smaller amounts of radioactivity, such as in the wipe test, where you're wiping a surface to see if there are minute amounts of radiation. And the reason this works is because the scintillation process is so sensitive, we have the ability to pick up even minute amounts of light coming off the crystal. Therefore, the well counter is a very sensitive measurement device. We also use the well counter to assay amounts of radioactivity, and one example is after you administered technetium-99m DTPA for calculation of GFR. You measure the amount of radioactivity in a very small amount of blood within a sample, but the well counter is able to do it because it's so sensitive. A thyroid uptake probe is also a scintillation crystal that you place at a small distance from a patient's thyroid, and you measure the background and you use the 2 counts and get the uptake percentage. The main point for now is to remember the thyroid uptake probe is a scintillation crystal-based device. I'm sure we'll talk more about both of these later, both with a wipe test, and I'll also get into dedicated podcasts on nuclear medicine thyroid because there's a lot there to unpack. That is enough review for now. I will continue this discussion on the next episode. Please tune in. Content of this podcast is provided for informal educational purposes only for radiology trainees and radiologists. Medical practitioners, please make your own independent assessment before suggesting a diagnosis or recommending any course of treatment. This podcast should not be used for self-diagnosis or self-treatment and is not a substitute for independent professional medical care. Please consult your own physician regarding any diagnosis, imaging interpretation, or course of treatment.